Good morning, New York. This is your FEMA Director, Carla Boyle. As many of you may be aware, and for those of you who are not, late last night there was a reported 1,000 deaths in New York City. These unfortunate deaths are the result of what appears to be a zombie-like virus. These infected persons suspected of carrying this zombie-like virus exhibit symptoms such as slurred speech, slow-moving behavior, and significantly high violent and murderous tendencies. The source of this virus has determined to be the result of a leakage of biohazardous waste in New York's water supply. We are urgently advising all New Yorkers to immediately refrain from utilizing tap water systems, and please be ensured that all pets, the disabled, the elderly, and children do not have access to water supplies such as faucets, hoses, and toilet water. Please do not be alarmed and remain calm. In order to pull through, we must work together to prepare and protect ourselves and our loved ones, paying special attention to the safety of our children, the elderly, the disabled, and our pets. The New York Governor, Andrew Cuomo, has officially declared this occurrence a state of emergency, and the National Guard has been activated. The Center for Disease Control and Prevention is already on the case, working tirelessly to develop a vaccine as well as a possible treatment for those who have already become infected. Due to the rapid spreading of the disease and the tremendous amount of those infected with disease, this is again a federal state of emergency. We ask that all citizens, in accordance with the law, act as they normally would. Those citizens acting in illegal and reckless behavior and violating emergency policies and protocols will be arrested immediately and without hesitation. As a continued effort to further contain the virus and eradicate it as soon as possible, there are certain protocols and policies that New Yorkers must take in order to ensure that we can further protect, prepare, and prevent the further spread of the disease. First and foremost, please do not go outdoors. It is important to note that out of the 1.6 million people in Manhattan, 1 million have already become infected with the zombie-like virus. These numbers are rapidly increasing, and the virus is spreading. People who have become infected with the virus may appear as your trusted friends and neighbors, but should they exhibit the advised symptoms of slow-moving behavior, slurred speech, and extremely violent tendencies, it is very likely that they are in fact infected with the virus, dangerous, and a serious safety health threat to you and to your loved ones. Should you or one of the members of your household or safe zone be suspected of becoming infected with the highly contagious virus as a result of transmission through Manhattan's water supply or through an open wound that is the result of physical and violent contact from a suspected infected person, please immediately clean the wound with rubbing alcohol and bottled water. Do not use tap water. Please take additional precautionary measures to isolate the suspected infected persons and secure them until we have developed and dispensed both a vaccine and a treatment for those infected. We must refrain from coming into contact with these infected individuals as they are again highly dangerous. Secondly, we urge you to please prepare an emergency preparedness kit if you have not done so already. Items to be included in your emergency kit should include a gallon of bottled water per day per person. We are estimating that it will be at least 1 full week until the lockdown has been lifted and we can safely return outdoors, so please plan appropriately. Please also remember to refrain from using water from Manhattan's tap water system. Additional emergency kit items should be non-perishable food items, utensils, and a manual can opener, as well as medications and health supplies for all persons in the household, including a first aid kit, emergency tools such as battery-operated flashlights, cell phones, and radios, as well as backup batteries. Important documents such as health records and insurance information, as well as family emergency plans, should also be gathered and included in the kit. Please, if you have pets, infants, and toddler children, please ensure to prepare a supply of diapers, formula, and additional food and health supplies. For a full recommended list, please visit emergency.cdc.gov. Additionally, although Manhattan has predominantly been the reported location of the virus, as an added precautionary measure, the following boroughs and locations will be on lockdown as well until further notice. These areas include all of the 5 boroughs of Brooklyn, the Bronx, Staten Island, and Queens. Long Island, New York will also be on lockdown, as well as New Jersey. By locking down Long Island and New Jersey, we can ensure the containment of the virus from reaching other areas of the United States. In the case that Long Island must be evacuated, the Coast Guard will provide additional services to transport citizens from Port Jeff and Orient Point, New York. Specific roadways, tunnels, and bridges that we ask you to keep clear of would be the Holland Tunnel, the Lincoln Tunnel, the George Washington Bridge, and most importantly, the Verrazano Bridge. The NYPD and the Highway Safety Patrol will be enforcing these closures. Do not, I repeat, do not utilize subway systems, as these systems are currently not secured. Should the Long Island Railroad and mass transit authorities, such as buses and cab services, be utilized during mandatory evacuations, we will make a public advisory as to where these services can safely be accessed. We ask that you remain in your homes or safe zones and do not evacuate unless your county or location has specifically been advised to do so. More importantly we also ask that all citizens keep clear of all major roadways, bridges, and tunnels. This is to ensure the ease of transportation of emergency vehicles and responders. Should you have an emergency and require transportation, we have set up toll-free numbers for each county. Please refrain from making local calls or dialing 911, as these phone lines are likely to be unreachable. In the case that your county is called to evacuate or is called to an identified safe zone, please promptly gather your emergency preparedness kit and all members of your household, immediately making your departure. Please also utilize any firearms and protection measures in the case of an anticipated attack from infected persons. In the case that you are in immediate danger and you must defend yourself, please be sure to fire or to aim at the head of the infected individual, as all other efforts will likely be ineffective. During this time, all toll booths will be disabled. Please adhere to all normal traffic safety measures such as stop signs and street lights in order to ensure the further health and well-being of the public. In the case that your family is separated, please establish an emergency family plan and identify a meeting zone. Please also communicate a designated contact number for an out-of-state family member or friend that can be reached in order to communicate important information such as your location and the status of your health. We have been working tirelessly to erect safe zones in multiple locations. Please do not evacuate to these safe zones unless you are instructed to do so. We ask that you make an effort to access your designated safe zone so we may account for all persons in the county. These safe zones will have access to food, safe drinking water, security from the U.S. Army and the NYPD, and medical care from specialized staff and healthcare personnel. We will also have an additional linguistically diverse staff to ensure that all information and protocols are communicated as effectively as possible to all persons. Additional support services will be brought in from the American Red Cross. Please be advised that upon accessing these safe zones, all persons will undergo a mandatory screening for the disease. Only those who are cleared of the virus will be granted access to the safe zones. Those who test positive for the virus will be placed in a secure and isolated holding unit until there is a treatment available or until other infected persons have received the vaccine. We appreciate your support and your compliance, and we are confident that moving forward we could stop the spread of the disease and protect our citizens. We have full and complete trust in our researchers and medical professionals that they will soon have the vaccine and hopefully a treatment. Once available, these vaccinations and treatments are expected to be dispensed at county safe zones, which will be announced through a public service announcement. Please stay tuned for announcements through radio stations and mass media efforts. For additional emergency information, please contact the established toll-free line for your county. Thank you again for your continued cooperation, and please be safe.